my name is Kellyanne Garthy and I'm an RN, and I'm here with Diabetes Support Services to show you how to do glucose testing. So at this point you've probably been diagnosed with diabetes and your doctor has handed you a glucometer and you may not be sure how to use it. So I'm going to show you all the parts that are necessary for checking your blood sugar and how each of those work and what they're for. So your glucometer will probably come in some sort of a pouch, and you should keep all of your supplies together within the pouch, as well as a little sheet that tracks each of your blood sugars as you take them. And we'll talk about how frequently you should take them in a minute. But first, let's get to the parts of the glucometer. This is a small model that's easily used in your car or if you're on the go. And this is one that a lot of people like to use. You'll see the display where it's going to tell you where your blood sugar reading is, and then this will be the entry spot for your strip, which I'll tell you about in a second. So the first thing that you're going to do when you take your blood sugar is use a lancet. A lancet is going to be a little poker that you put inside this little device to poke your fingers with in order to get a drop of blood. Open these up, and they come in different gauges. A gauge is the size of the needle on the lancet. This is a 30 gauge. As you can see, it's very, very, very tiny. So that's a 30 gauge lancet. And this is the device that you're going to put your lancet in order to poke your finger. It's very easy. All you do is take off the little top part, and then inside here is where your lancet is going to go. So you take your lancet out of the box, and you always want to make sure that you use a different lancet every single time. And the reasons for that are because you could get bacteria on the end of the lancet, and then also the needle becomes duller every single time that you use it. So I'm just going to get a new lancet out of the box, and these lancets are largely interchangeable, so you can use many different brands of lancets and many different brands of devices. So you might just pay attention to the gauge of it. The smaller the gauge, the better for people with sensitive fingers. So you take the top off of the device, just flip it off, and don't take the top off of the lancet yet, because you're going to just push it down into the center of the device. You can just push it in all the way until it clicks, or you can just mildly push it in and then pull this back, and it'll pull it all the way down until it clicks. Then you can just twist off the end of the lancet gently, because it's such a tiny little needle, and then pull off the circle part that covers the needle. And then you'll put your top back on, being very careful to not bend the needle at any point in time. And then on this device, you also see the measurement to the depth of how deep you want the needle to go when it goes into your finger. If you have a very thick or callous finger, you might dial it up so that it goes the deepest. If you have very fragile or thin skin, you might dial it all the way down so that it goes the most shallow. All the way up for the deepest, and all the way down for the most shallow when the needle comes out this end. Some people don't like sticking their fingers. They're very sensitive, so they have used their forearms. Be careful with this, because forearms are meant for very specific needles and very specific devices that are calibrated specifically for the blood that you get from the forearm. So unless your device says that it's okay to use the blood from your forearm, you must only use your fingers, or the little fatty part of your thumb area is okay as well. So you have your needle in place. You've got this pulled back so that it's locked and loaded and ready to go. And then what you do when you put the needle up against your finger is just push this button. So before you do that, you look at your fingers and you want to rotate your sight every single time. Alcohol pads. So you want to use alcohol to wipe off the end of your finger or wherever you plan to do your testing. Be careful when using the alcohol. You want to make sure that it's completely dry before you stick your finger. And also, alcohol is a sugar, so it could possibly skew the results of your testing if it's not dry yet. Make sure that you rotate your sight every single time you stick your finger. And once again, always make sure that you're using a new lancet every single time. So we'll come back to that in a second, but right now I want to talk about the strips and how they go into the glucometer. After you stick your finger, you're going to apply it to what we call strips. Most glucometers are now equipped so that the strips just magically go in there and you don't have to choose any sort of code. Sometimes you'll have a glucometer that will ask you to verify that the code on your strips is the same that the one is showing up on the glucometer, so that you don't get altered results because of the way it's calibrated. This strip will actually go into the glucometer, and you see there's two ends of your strip. You have the end that looks like a little technical piece of computer, and that's the one that you want to put directly into the machine. And then the other end will have just a little divot out of it, and that's going to be where the blood will be applied. But you put this into the machine before you stick yourself, because it'll be ready to go, turned on, and then as soon as you see the little drop of blood blinking, it's ready to take your blood. So you can set that to the side, and that can sit usually for a couple of minutes while you deal with sticking your finger. Okay, so you've got your device locked and ready to go. I'm going to dial this to the middle. I have kind of not calloused fingers. They're just everyday use sort of fingers. So I'll put that right in the middle. Take the alcohol swab and swab off my finger and wait for it to dry. I've got my device ready to go with the strip in it. I didn't need to coat it because these strips are automatically coated to this machine. And you just push this right up to your finger with a fair amount of pressure, not really pushing down hard, but just enough so that your finger is pushed in a little bit. And then the big button on the side, just give it a push and it jumps out, and you squeeze that drop of blood. Apply it directly to the device, and you can either wipe off your blood with the alcohol swab or have a little piece of cotton. And my blood sugar was 111, and I've already eaten today, so that's acceptable. So when you're done with your glucose testing, you want to make sure that you dispose of your lancets in a red biohazard container. You can have some of varying sizes. This is kind of a bigger one for a lot of extended uses, and this will be where all of your lancets will be disposed of, and also your insulin needles in the event that you are giving yourself insulin. So you just take your lancets and throw them on in there and keep it in a locked, safe place away from children and pets. And once these are filled, then you'll need to send them to the address that's listed on the label or the company that you got these from. So that's how you test your blood sugar. Make sure that you write down what your results were at every single time. Typically, most people check their blood sugar in the morning after they've fasted all night long, and also before meals. Sometimes your doctor will ask you to check postprandial, which means within the hour after you've eaten. And there are varying levels as to what those numbers should be. So when you have your biohazard containers, these are the containers that you must use for disposal of any of your sharps, including lancets or insulin syringes. They must be used because this is the law. They must be disposed of properly via a biohazard disposal company. It's been heard of to use coffee cans or Tide bottles, and although those keep the needles safe from children and pets, they don't comply with legal standards. So you want to make sure that you're getting one of these from your local pharmacy, or order them from an online company and sending them for correct disposal, and not just throwing them into your usual waste disposal. This has been a demonstration from Diabetes Support Services on how to use your glucometer for doing blood glucose testing or blood sugar testing. Once again, this is your glucometer. This is the device for putting in your lancets for sticking your finger. These are your lancets. And these are the strips that you'll be using that actually have the reagent for testing your blood glucose. So always make sure that when you're checking your blood sugars that you're recording whatever your number was. Most people check them in the morning, especially before breakfast, after you've been fasting all night long, and anytime before meals. Sometimes your doctor will ask you to do a postprandial check, which is between 1 and 2 hours after you've eaten, and then record those numbers down on a list that you keep in the pouch with your glucometer. And with each number, it's also good to recognize any event that may be occurring at that time that might contribute to your number either being high or low. For example, if you just were at your grandchild's birthday party and you had a piece of cake, you might want to write that down if your number was 307, very high number. So this has been a demonstration of how to check your blood glucose using a glucometer from Diabetes Support Services. Once again, this is the glucometer, the device for sticking your finger, the lancets that go in the device, or the needles, the strips that go into the device that will help you check your numbers, and the pouch that contains all of this information to keep with your record of blood sugars.